Hello, I'm Dr. James Nill, Nill Family Chiropractic and Wellness Center, and today we're going to talk about hand and wrist pain. The majority of wrist pain that I usually see is anything from a sprain or a strain. A strain has to do with a muscle being pulled, and a sprain has to do with ligaments being pulled, and which can happen, you see a lot of times with falls or different kind of sporting events and sports injuries. And so we're going to talk a little bit how to treat that, along with carpal tunnel syndrome. So we're going to teach you how to treat that on your own and how I can treat it in here. So, okay, the first thing we're going to do is what's called anodyne therapy, and then for demonstration purposes, the patient's sitting up, but usually they'd be laying down in a comfortable way, and I'd also put some moist heat packs on their back and whatnot, and then let them listen to some music. So what this is, you can see this pad right here. This is a light therapy that comes out. It has a therapy of 890 nanometers. It actually gets attracted by and absorbed by the red blood cells, and then the hemoglobin within that releases nitric oxide. Nitric oxide is a natural vasodilator. It opens up the blood vessels and lymphatic channels, and it flushes out all the inflammation, or most of it at least, in the area, and therefore gets rid of a lot of pain. Every joint in the body has a group of muscles that helps stabilize that joint, and in the wrist joint, for example, has a group of muscles down here that do that exact thing. An example of those kind of muscles you see is actually in your shoulder too, the rotator cuff, which actually stabilizes the shoulder joint. So the same thing applies for every joint in the body. So what we're going to do, if somebody has a sprain or strain, we find out where the problem is. If it's a ligament issue or a muscular issue, either way we treat about the same. And we start at the elbow, and what we do is called origin insertion therapy. But I'm going to use this tool right here to actually help get in there. So we start with the elbow, work in there, and work all the way down the extensor group. And then we can also help work on the flexor group in here. And what this is doing is it's helping actually break up adhesions in there and actually neurologically balancing the muscles out, so they'll help stabilize that wrist and take the pressure off the ligaments and gets rid of the pain. The next thing I'm going to talk about is what I do to treat carpal tunnel syndrome, and I kind of went over that when you look at the elbow footage. But what it is there's a ligament, the transverse ligament of the wrist that comes here, and a median nerve comes underneath. So what I need to do is actually get in here and help work on that median nerve. First I do is start with anodyne therapy, then I come in here and stretch that ligament out with a little massage. Then we can do gua sha and get in there, get in real deep. And then we're going to use a board and we'll actually do manual manipulation, which helps spread that apart, which I'm going to demonstrate right now. Okay, now what we want to do is come in and actually do joint manipulation in here, and I'm going to use this board here, and what it does is toggle board, it actually toggles down, and the reason we do this is so he could tell you that doesn't feel as good. When we do it this way, it actually goes through the joint a little easier with less resistance on the back. So do it a few times. Then we work on some of the fingers, thumb, pull it around, turn the hand around, come down. There you go.